If this doesn't work out, we're just gonna stop for the day. Hey friends, it's your good friend Tim Campbell-Smith, and today we are talking about the difference between psychotherapists and social workers in a clinical setting. Now, you gotta know that these two professions, especially in the clinical sense and a counseling sense, have a lot of overlap, but there's also a lot of big differences. So I want you to know kind of what are those overlaps and what are some of the differences. Ultimately, and I'll get to this at the end, if you go to a psychotherapist versus going to a social worker, you're going to get largely a very similar experience in counseling. Both are highly trained in their fields, but they come at it from very different perspectives, which is what we're going to talk about. So we're going to cover the differences in training, the difference in focus areas, which is kind of based on the disciplines they come from, and some of the differences that you might expect in the experience with a psychotherapist versus a social worker. Now, before we go too far, make sure you like and subscribe for all things mental health, higher ed, business, photography, and life. So let's start with the discipline focus areas. Psychotherapy is narrower, social work is broader. I'm going to reference my notes to make sure that I totally get this right, but according to the College of Registered Psychotherapists of Ontario, psychotherapy is primarily a talk-based therapy and is intended to help people improve and maintain their mental health and well-being. So pretty straightforward, kind of one focus area, emphasis on mental health. Versus social work. Now, please note, social work kind of has a governing body, but then also has a national association that influences our work. So the Canadian Association of Social Workers says that social workers are regulated health professionals who work with individuals, families, groups, and communities to improve individual and collective well-being. I'm going to make a note here that psychotherapists are also a registered and regulated health profession. In the province of Ontario, I think in every province in Canada, probably most states and countries. Now that's pretty broad. Personally, that feels like what represents social work. The Ontario College of Social Workers, though, takes a little bit of a narrower, more clinical focus to social work. They say that social workers are people who work with their clients to address challenges through a process of assessment, diagnosis, treatment, and evaluation. Again, the problem is with the Ontario College definition is that it's very clinical. Also, please note that assessment, diagnosis, treatment, evaluation are not used in the typical sense like a psychologist would use or a psychiatrist would use. We're talking like a social work diagnosis, a social work treatment plan, which is very different. Here's a great reference. If this helps you remember the difference between a psychotherapist and a social worker. A psychotherapist will ask you if you think the glass is half full or half empty and how you feel about it. A social worker will ask you if you realize that the cup can be refilled and work with you to teach you how to refill your own cup. There are some other key differences though. Psychotherapy is almost entirely and wholly clinical and counseling based, whereas social work can be way broader, and we'll cover more of this in training, versus psychotherapy, which goes very deep into counseling and counseling psychology. The greatest one reference that I loved that I heard from a prof is that any place where there is injustice or where people have to navigate large systems and institutions is where social workers are. So if someone is food insecure, chances are they're also struggling to pay their bills. And so a social worker would recognize that and would help that person and work with them to secure food, and then also work with them to secure funding or opportunities to pay their bills, because the food system and the poverty system can be very difficult to navigate. So that's where a social worker would be, which is a great segue into training. So psychotherapy. Psychotherapy has to be achieved through a master's degree, typically a Master of Arts or a Master of Arts in Counseling. So you're looking at 2 to 3 years of training, depending on the program. Absolutely requires an undergrad. I think there might be some, but very rare exceptions where you don't require an undergrad. But otherwise, you're looking at a 4-year undergrad and then a 2 to 3 year master's degree. And that degree focuses on all things counseling. So you may end up working in different settings like inpatient psychiatric or outpatient addictions or private practice counseling, but you are trained in your master's to deliver counseling and psychotherapy in all of those different settings. And there's a real focus on just the skills and the modalities. Versus social work. You can practice as a social worker. You can technically do private practice with the Bachelor's of Social Work, the BSW. But most clinical settings, most insurance companies, to cover for insurance require the MSW, the Masters of Social Work. Social work is training you for breadth, whereas psychotherapy is training you for depth. So when you graduate with your Bachelor's of Social Work, your BSW, you have to, with equal levels of competency, be able to say, go work at a food bank, working in that food bank, getting people what they need, also navigating systems, intake, and support. And at the same time, you have to be able to go work in a hospital and work with people to support the hospital system, the medical system, providing counseling or support when people receive a difficult diagnosis. And then with equal competency, you have to be able to go and provide housing support and lifestyle counseling for people struggling with housing, and so on and so forth. See what I mean by breadth? I'm also going to make a statement here, and this comes with a big but, a big caveat. Social work MSWs, Masters of Social Work, which is typically the gold standard in social work, are more competitive than MAs, than Master of Arts in Counseling. This is primarily because, and this is where the big but comes in, there has been a surge, I think in the last 10 years or so, of more online programs taking in and pumping out graduates in psychotherapy. So I'm mainly looking at Athabasca University and Yorkville University. So because of those programs, because they have larger and more frequent intakes and they graduate students, it's easier to get in for those. Otherwise, though, generally speaking, MAs in counseling and MSWs are all still very competitive. And both of them still require practicums and supervision, and both still recommend ongoing training after graduation. So then we move into our third area, which is the experience with. So what is it like working with a psychotherapist versus a social worker? Again, it's going to be very, very similar working with the two. The first caveat I will say with psychotherapists is that you can get registered psychotherapists who are trained in unique modalities like art therapy. So in Ontario, if you graduate from a program in art therapy and you are licensed to practice art therapy, your licensing actually goes through the College of Psychotherapists. But in that case, it's still going to be private practice. It's still going to be counseling, just a different way of doing it. Psychotherapists, you're most likely going to encounter them in private practice, where you go to their business, online or in person, and they provide counseling, versus social workers, which are everywhere. We walk among you. Psychotherapists will focus on and almost exclusively only do talk therapy. Social workers can do talk therapy. They can also do a lot more. Or there are settings where we don't do talk therapy, or where we use our training in talk therapy, but we use it in different ways. So a social worker may work in a hospital and they may provide brief counseling and emotional support to a family who just received a very difficult diagnosis, but they're not in private practice. Generally, you will have the same experience in a clinical mental health setting between working with a psychotherapist or working with a social worker. Psychotherapists will typically focus on you, your well-being, your concept of well-being, and what you need to do for your own health and well-being. Social workers are more likely to take a very big picture approach, try lots of different modalities, or ways of counseling and providing support. Social workers may also prioritize referring to other services, because a key part of social work training is system navigation and referrals. And those are the big differences. There's a lot of similarities. There's a few notable differences. Either way, if you're looking for a therapist to go to, you're going to be well cared for with a psychotherapist or a social worker. They might just, a social worker might come at it with a bigger picture view. A psychotherapist might focus entirely on you. Both are okay. Both work. Comment and let me know if you have experience with either or both, a psychotherapist or a social worker. Interestingly, I have been to all three for my mental health. I think the most I've worked with 2 or 3 therapists who were social workers. I worked with 1 psychologist and 1 psychotherapist, and they all provided equal levels of care. But comment and let me know what you have experience with. As always, make sure you like and subscribe for all things mental health, higher ed, business, and life. Otherwise, we'll chat soon. Bye for now.